Researchers at Harvard say that states like New York and Massachusetts have worked hard to turn the pandemic tide. The farther west and south you go, it's a different story. As Juli McDonald shows us, mitigation practices there, like masks and social distancing, are nearly non-existent in some spots.
I think if we loosen up and proceed as normal now, we will be slammed in the fall. Schools will be shut down. We will all be locked up for 6 months.
As suggestions and scenarios swirl regarding what life will look like come September, global health expert Dr. Ashish Jha believes the Northeast could potentially be like a separate society.
There are few, if any, places in the world that have the kinds of outbreaks that Arizona and Texas and Florida are having. And yet you still have people who are in denial, who think this is nothing worse than the flu, or it's no big deal.
He applauds strict shutdowns and cautious reopening phases that have supported more positive trends here, but says we're far from being in the clear.
The fall is going to be a hard time. We're going to be spending a lot more time indoors. The flu season is going to be back, and COVID is not going to be gone, and we're not going to have a vaccine.
Dr. Jha does believe the return to school in Massachusetts could almost look normal if August COVID numbers go way down and communities do not ease up.
Packed bars, terrible idea. Packed indoor dining, terrible idea. But if we do a good job and if we have great leadership and real vigilance and data-driven policies, we can get through the fall pretty effectively without having to shut the whole state down and without losing a lot of lives.
Juli McDonald, WBZ News.